Health disparities has been defined by Healthy People 2020 as a particular type of health difference that is closely linked with social, economic, and/or environmental disadvantages. The reasons for health disparities among the Native American population can be broken down into three categories. Historical scarring is the first category. Beginning in 1819, U.S. Congress began a process to take away land from the Native American people. Guns were used to secure the land from this population. Intimidation tactics were also used, including imprisonment and separation of families. Children were removed from the home and were threatened to not be returned if the parents did not surrender their land to the government. Children were also put into schools that were established to integrate the Native American children into Western culture, stripping them of their heritage and cultural practices. Social determinants are also identified as a reason for Native American health disparities. Relocation and depriving the Native American population of their land also remove their livelihood and their ability to provide for their families. Financially, this has led to a cumulative disadvantage and poverty for generations still today. Availability and access to care are also reasons for healthcare disparities. Many of the Native American people, even today, live in very rural areas that do not provide public transportation or families or facilities local to their homes. This puts them at a disadvantage to good healthcare access. Due to the historical mistrust of the government, Native Americans often feel discriminated against and treated with unfriendly and unwelcoming staff and providers.